Consult Asia delivers cutting-edge training to empower people to achieve their maximum potential. Engaged in developing and delivering customized learning and development programs specializing in leadership, business, sales, and life coaching. True to its name, Consult Asia works with partners worldwide in Asia, North America, Europe, the United Kingdom, and Australia, all from diverse industries: hospitality, tourism, banking, real estate, retail, direct sales, legal, manufacturing, and oil and gas. Consult Asia closely works with partners in their people development and business enhancement programs to achieve their business goals. And the Consult Asia global team is just as world-class. Consultants and facilitators, coaches and mentors are industry experts from distinct backgrounds and cultures. Consult Asia delivers only high-quality training solutions and proactively pursues strategic alliances with global firms and consultants to stay ahead in the industry. Consult Asia Global, the world's preferred training group.
Hi everyone, good evening and welcome to my episode called Chiropractic Care Tonight. My name is Tinette Cortes and I'd like to say hello to my viewers, my friends, my family all over the world. And I hope that everybody's safe at home and that you guys are all staying healthy. So I'd like to introduce my co-host, my very good friend tonight, Jury Domino. Hi, Jury.
Hello, Tinette. How are you today?
I'm really good. And you, how
that's
are you
fantastic. Hi, everyone there. Hi, everyone in my family in Australia, in US, and of course here in Manila. So hope everyone is doing fine and everything is great. It's a wonderful evening tonight.
Right, great. Okay. Well, Jury, tonight's episode, actually what prompted me to organize this particular episode is because I myself have been going through, a lot of aches here and there, some anxiety and some stress. And, probably we have tried a lot of things. We've tried meditation, right?
Yeah, in my case also, I've heard about it, but honestly, I was kind of bit scared. So I really want to learn. I really want to learn about this. So just to take away that fright, because I've seen this. I have few friends who also practice this, but I did not attempt because I had that I was a little bit afraid. So maybe this will be a good time for me to really open my idea and of course go into the clinic.
Open your mind. Open your mind, open your heart, open your ears, and open your spine. Okay, all right. So,
right? So I really need, I probably need this.
Yeah. Okay. So let's introduce our guest for tonight. Our guest tonight is a native New Yorker, graduated magna cum laude from Manhattan College with a concentration in sports medicine with minors in biology, psychology, and chemistry. He studied the art and science of chiropractic at the Southern California University of Health Sciences, where he earned his doctorate. Certifications in active release, soft tissue technique, nutritional response testing, neuro-emotional technique, and other non-force healing techniques were also obtained. And he's going to say or share with us a lot more about his experience in this particular field during the episode. Our guest now lives in lives and practices in Manila. So, ladies and gentlemen, please welcome Dr. Scott Jahn. Hi, Dr. Scott Jahn. Good evening.
Good
Hi,
evening.
Tinette. How are you?
I'm really good. Thank you. Thanks so much for joining us tonight.
That was my pleasure.
I know you're very busy with your patients day in, day out. And it's really very good that you're able to join me and Jury tonight, because aside from the two of us, we have a lot of friends who will be able to benefit immensely with this particular episode. Okay, so Doc Scott, all right, let me call you Doc Scott.
Sure.
You know, there's this misconception between chiropractic being a treatment and it being a lifestyle, a holistic lifestyle. And I personally, the very first time that I saw a chiropractor was when I was 19, because I have 15-degree scoliosis at that time. Now I'm not sure, but it would have probably improved already over the years. But yeah, and I went to the chiropractor because I wanted to have my scoliosis treated, and all the pains that went with it. But as we were conversing the other day, you've mentioned that it's not actually a treatment, and that's really interesting to know. So can you please tell us more about this? I mean, what is chiropractic? Because I don't think a lot of people are familiar with it.
Yeah, including myself.
Yeah,
Exactly.
I get that a lot. Yeah, sure. So let's start by telling you what chiropractic is not, right? It's not a treatment. So the word treatment implies that somebody comes in with a specific condition, right? And now you're trying to manage their symptoms. You come in with headache and you're trying to manage the throbbingness, or you come in with high blood pressure. You're trying to manage that, which that's not exactly what chiropractic is. What chiropractic is the detection and correction of what's called spinal subluxations. I know that's a kind of a big fancy word.
It is
but
a big word,
yeah. A subluxation is simply a bone that's moved out of its proper alignment, and now it's causing irritation to the surrounding soft tissue, which then creates inflammation, which puts pressure on the nerves. And as any medical dictionary will tell you, it's the nervous system that controls healing. It controls how well your body functions. It's the master control system.
Interesting. So that's basically the gist of what chiropractic is all about. Jury,
it's about
if I go to a chiropractor, what are the benefits if I visit to a chiropractic clinic? Yeah.
So again, chiropractic in its purest form is the detection and correction of spinal subluxation. Now, there are many offshoots, kind of like there's offshoots in the medical community, right? You have this ologist or that ologist, and chiropractic is no different. You have some doctors of chiropractic that will also specialize in nutrition, and some that will also specialize in various different techniques like applied kinesiology or something of that nature. But in its truest form, what we're trying to do is make sure that the nervous system is functioning as greatly as possible, right? And we do that mainly by checking the spine and seeing that the vertebrae are in proper alignment and is not putting pressure on any nerves, right? And then if they are, we give what's called an adjustment, which is simple, gentle, fast thrusts into either the neck, low back, or mid back to put the joint back in its proper physiological place.
Okay.
Yeah, because I have also some friends who have this misconception that it's also just it's just like a massage. So they think
no.
That's what my father thinks. My father thinks that he's a fancy massage therapist.
Oh, but I must have to tell you. I must tell you, Jury, that a session with a chiropractor is you just feel like water after. It just relaxes the whole system. I mean, if there's anything that's tense, whether it's your shoulder or your back or your hip, after you just feel like you don't want to get up. You just want to go to sleep. You feel so relaxed. So yeah.
Yeah, but oftentimes people get immediate relief because we're taking pressure off the nerve. But depending on how long that subluxation's been there, if it's been there for years, it's going to take some time because the ligaments are now used to being in a different position, and they're going to pull that bone back out. So you have to kind of gently work it back in.
Yeah.
Much like how a dentist can straighten teeth. You put braces on, and you got 2 years worth of slowly cranking them back in proper position.
Right.
But is it kind of painful, or is it tolerable?
It's not
No, in
painful at
fact,
all.
most people actually enjoy it. They get great relief, like Tinette will attest to. They get great relief because it's kind of, you have all this stress build up because you have these bones that aren't moving and they're putting pressure on the nerves, and all of a sudden, wow, you get an adjustment, pressure off the nerve, and you feel so much better.
And that's good.
Yeah. Well, how did you get into chiropractic? Would you tell us a little bit about your story, how you got into this?
Actually, I wanted to be a medical doctor to begin with. So I went to undergrad and started to kind of make the rounds of going to be a medical doctor. That's why I have so many minors, because I wanted to be a sports doctor. So I had to kind of make my own little program, which is why I had 3 different minors, because I'd take a bunch of other courses.
Sure.
And through the time, I volunteered in a hospital in Columbia Presbyterian in New York City. And the more I started to learn about medicine, the more it just didn't fit with my own personal values. And I'm not saying anything wrong with medicine. It saves thousands and millions of lives, right? But it just personally, I wanted to affect change before it got to an emergency situation.
Right.
So I look for other more holistic, well-rounded kind of healthcare. And chiropractic's the largest, fastest growing holistic healthcare in the world. And so that's what
there you have it. All right. Okay. Well, thanks for that, Doc Scott. Now, ladies and gentlemen, if you're watching, please feel free to ask questions. Comment on the comment section. Let us know where you're watching from. If you're in the Philippines, if you're in Singapore, please, I could see some viewers who are based overseas. Just please say hello. And if you have questions, feel free to type them on the comment section. So,
I lived in Singapore for 2 years.
I'm sorry?
I said I lived in Singapore for 2 years.
Did you? Yeah. But I think you like the Philippines better, right?
Much better diving. I think that the waters are a little bit more polluted.
I don't think, is there a very good dive spot in Singapore?
I don't think there's any diving.
No. But the Philippines definitely is a treasure, right? Okay, so Jury, I was gonna ask you, because Jury here is a fitness trainer. I mean, he's a very fit and athletic person. And Jury, I just also wanted to ask you, what are the most common, pains and body aches that you have been, experiencing or encountering?
Typical of an athlete, sometimes you get muscle sores, and of course there are really times that you have some, you have pains in different parts of your body. So I would like to ask, Doctor, what is the line if I go to a chiropractor and then, or going to an orthopedic? So how would I identify if I need to go to a hospital right now to correct something, or this can be done by a chiropractor?
Sure. So first of all, I would say that you probably don't need to be either or, because chiropractic's for everybody. We live in a very artificial environment these days. Most people spend the majority of their time sitting, either at a computer, sitting watching TV, sitting eating, or sitting constantly. So chiropractic is an excellent avenue towards people to combat the modern lifestyle. Now, there's some things, right? So chiropractic is not really appropriate if you would have something like a broken bone of some sorts, or if you had a muscle tear, right? If you had a muscle tear, you need to get that surgically repaired, like a labrum in the shoulder or something, or certain disc issues. If you had what's called a sequestration, if the disc material actually broke off and is floating around, you're going to have to get that removed. Same thing like a meniscus tear or something like that in the knee. You have to get that surgically fixed. But that doesn't mean that you should explore chiropractic too, because what heals the body? The nervous system. And after you go to your surgery, you're going to need to heal, and you're going to need to make sure you have a nervous system that allows that healing process to take place. Just as you would need good nutrition, right? I wouldn't recommend anybody get surgery and then go out and eat fried foods all day, it's not going to be beneficial. Same thing, I would recommend that you have subluxations that cause nerve interference.
So I have a question, Doc. First, is this okay for all types of age, young kids or seniors? And also, are there medical conditions to study before going into that thing? For example, if I'm high blood or I have high blood pressure, so is there a limitation? Yeah.
There's quite a good amount of research in the Journal of Manipulative Physiotherapy on the benefits of chiropractic with hypertension and high blood pressure. A study in 1988, one in 89, and a third one I think in 2001 maybe, all showing how post-chiropractic adjustment lowers blood pressure. So for blood pressure, excellent, right? Now, there are certain conditions. If you had something maybe like lupus or something where you have very lax ligaments or something of that nature, you probably might want to stay away from at least the high velocity adjustments. Now, I mentioned earlier, there are many different ways to adjust a spine and to try and help the nervous system function better. You can do a low force adjustment, like we adjust babies, right? Even 1 day old babies. And that's a very low force. You just less than the amount of pressure on your eyeball, and on a vertebrae can help move that vertebrae back in place. So there's always different techniques that you can use.
Yeah.
Okay. So a while ago, I also asked Dr. Scott. So, like for example, in my case, if I go inside in a clinic, is it just a one session or it's a series of session? And before doing a series of session, do you take tests? For example, there's an X-ray or you check on my back. How is the process being done inside in a clinic?
That's an excellent question. So what would happen is you first come into the clinic, we do an examination, right, to make sure that you're a proper candidate for chiropractic. Like we said earlier, if you had some kind of condition that we felt was more a surgical case, like a torn ACL, chiropractic is just not going to help that. You need to go get surgery. If we determined you were a good candidate for chiropractic, then we would have to send you out for X-rays because we need to see how much damage and degeneration has been done to the spine. That'll give us a good indication of how long it'll take to correct, right? Because one of the things with a spinal subluxation is you don't always feel it. You only feel about 10, 15% of your nervous system, called your sensory nervous system. The other 95% you don't feel, right? The classic example would be heart disease. Usually 50% of the time, the first indication that you have any problem is death from a heart attack. Yet you're walking around just fine, right? So an X-ray is going to give us an excellent idea of the condition of the bones, alignment, if you have any degenerative disc disease, things like that.
So usually, Doc, what's the maximum?
Sorry to interrupt you, but before we move on to your next question, can I just read some of the comments because we're getting some comments from the viewers. So we have a comment from Miss Lorna Banyaga. She's watching from Singapore. Hi, Miss Lorna. Nice to have you again with us tonight. And we also have a comment from Erica Poyawan. Is that correct? Erica says, hello, Dr. Scott, Jahn, Coach Tinette, and jury. Hello, Erica. Thank you for watching. Raquel Ventura Kwong says, hello, Ma'am Tinette. Hi, Raquel. How are you? Erica also says that chiropractic care is the detection and correction of subluxation. Did I say that correctly, Doc Scott?
You did. Yeah, you did. Very good.
Okay. And she says chiropractic care is not a treatment. It is the detection and so she said that already. And she also said, with all the relief a person feels after an adjustment, what is the ideal activity to do after a chiropractic adjustment? Should I sleep right away or do other activities, for example, sports? And before we answer your question, Erica, let me just read a couple of other comments. And of course, I would like to say hello to Christopher Sabo watching from Nigeria. Can you believe that? We've got viewers from Nigeria. Hi, Christopher. Good to have you tonight with us. And we'll get into Kath Hattie's question in a bit. But
we have the same question, with Kath. Anyway, going back. So my question was
We'll answer your question first, and then we'll go to Erica's question after
Correct.
you. Okay, sure.
Correct. So, if what's the maximum session if I go? Is there a maximum session that should I attend? And if ever I'm already okay, is there a maintenance after that? You have to check us after that.
So, a good way to think about it would be like thinking about, is there a maximum sessions for going to the gym? Right, you know, it's a personal choice. Sure, you can choose not to go to the gym, but studies have shown that you're much better off going to the gym. Right. Same thing with going to a chiropractor. Right. Once you get your spine stable and in a proper place, the alignment is good. You don't have any degeneration. It's always good to go back to a chiropractor again, depending on age, lifestyle, dietary habits, exercise, things like that. Once every 2 weeks, once every month, somewhere around there. Because we can't feel a subluxation. And studies have shown it takes about 2 weeks of pressure on a nerve where you start to get degeneration of that nerve. So within 2 weeks to a month, somewhere around there.
Okay. I have some few questions here, Doc, from Kath Hadi. What is your actually, this is also my question during the start of the session. What is your advice for people who are skeptical to see a chiropractors? How do we choose a qualified chiropractor? How can we be at ease? And also, I have another question from Michael Carlos Abisamistan. I'm a believer of chiropractic care. May I have Doc Scott contact details? We'll go on into that later. Doc Scott will give his detailed number later. So again, sir, what is your advice for those who are skeptical to go to a chiropractors?
The first thing I would say is to check credentials, right? You want to go to a chiropractor that's gone to an accredited school. In the United States where I'm from, there's 18 accredited schools that somebody can attend. In Europe, there's several excellent schools. Australia has a school. I believe Mexico just opened a school within the past couple of years. So that's number one, because a lot of people can call themselves a chiropractor depending on laws of the country they're in, but yet they haven't had the proper training. So that'd be the first thing I would do. Second thing, with the internet around, it's perfect to look up Google reviews, right? Facebook reviews, things like that, and see what past patients had to say. All right. Yeah. And then just meet the chiropractor. Most chiropractors will give a free consultation and just talk to them and see if they're in alignment with what your personal views are, and go from there.
Okay. Well, that's interesting. I'm just curious why there's no school here in the Philippines that offers some.
They're actually they're trying to get one.
Oh, really?
Making a university is not an easy task, but they're working on it as we speak.
Okay. All right. Well, here's really what amazes me a lot is that we didn't know. I personally didn't know that this had something to do with helping relieve stress and anxiety and depression. Can you tell us a little bit more about how this is directly related to, helping manage anxiety?
Sure. So let's go back to the nervous system, right? So you have two main types of nervous system. You have what's called a sympathetic nervous system, and you have what's called a parasympathetic.
Parasympathetic, yeah.
Yes. So your sympathetic is your fight or flight. It's to fight the proverbial tiger, so to speak. And then your parasympathetic, we call it the feed and breed. That's what causes your healing, repair, your digestion, things of that. And they kind of play like a seesaw. Either when one is up, the other one's down, right? So when we're in a stress state, we're in a sympathetic dominance, right? And that serves us very well in the short term, because things like your adrenaline and cortisol go up for quick energy. You get things like your cognitive performance goes up. Your cardiovascular system increases tone. Your cardiopulmonary, so you get more oxygen in, so you can get more energy. Everything is designed for you to get stronger at the right exact moment. The problem with stress and anxiety is, especially with mental emotional stress, right? You can have physical stress or chemical stress, but if we're dealing with mental emotional stress, you get that same alarm state and all this energy is in the system, yet there's nowhere for it to go because it's a mental emotional stress. So it's just running around the system. So your immune response will be subverted and go down, right? Your memory and your learning goes down. Your sexuality goes down because you don't need it for fighting the tiger. Insulin resistance and weight gain go up. Hypertension, fatigue, all these things go up with the chronic stress response. So a chiropractic can add to this this problem is chiropractic can increase the tone of the parasympathetic system, right, and get you in more of a breathe and out of that initial alarm stage. Not to mention that chiropractic in its purest form. Now, if we take some offshoots of chiropractic like applied kinesiology or some of these other ones, there are techniques that you can use. Some of them energetic, which isn't technically chiropractic, but chiropractors using things like neuro-emotional technique. So we would some specific spinal adjustments while we kind of either hold some pressure points on the skull, and we can release that trigger alarm state.
Wow. So you mentioned something about mental and emotional stress, but what about the chemical side? Does chiropractic directly affect the chemical imbalance that's going on, or like the serotonin or whatever, dopamine and
so again, when it comes to stress, like prolonged stress, right? We're going to get all kinds of things like insulin resistance. We're going to get opportunistic infection. Your bone will decalcify because we're very acidic and the body's trying to buffer that out. So getting into a parasympathetic dominant state will relax these things, will relax the nervous system, and will stop the cortisol release, stop the adrenaline release, and get you back into a proper state.
Interesting.
We have a question here, Tinette, from Riz Matsunaga. Good evening. This is a very informative talk. Chiropractic is so new to me, but interested in learning more about it. Is it true that it helps boost the immunity? Do we need it now more than ever, especially in these times?
Oh, thank you for that question, Riz. Yeah. Okay.
Yeah,
go ahead,
I would say
Dr.
right. So we touched on earlier a prolonged adaptive response to stress, and one of the primary things is decreased immune response. So if we can get somebody out of that stress response, we can start to get the immune system working again. Not to mention that the nervous system controls the immune system, right? So to have a healthy nervous system, we can stimulate making of proper white cells, to help fight infection and things of that nature, and go from there.
Wow. Okay. I guess before we go to our next question, I think Arnel Morales is saying hi. Hi, Arnel. Arnel is my managing partner from Consult Asia Global in South Luzon. So thank you for watching, Arnel. So Jury, I'm sure you have already been wanting to visit a chiropractor before. And so I guess my question is, what is the difference? And I think this is related to what you have already mentioned earlier, Doc Scott. What is the difference between, say, a chiropractor and an MD or a PT? In terms of expertise, in terms of areas of expertise, and how do we guide people, where to go for what symptoms? So I don't know if that makes sense.
I get it. All right. So let's take chiropractic and a medical doctor, for example. We both have very similar hours of schooling, right? The difference is the schooling of a medical doctor goes a little bit more towards pharmacology, and chiropractic is a natural healthcare. So we don't really get too much pharmacology, if any at all. We get some biochemistry, but we don't really get too much pharmacology. On the contrary, we get a lot of education on nutrition, and medical doctors barely get any. Maybe an hour or two in the entire curriculum of nutrition. So that right there can tell you where the value is, or where the philosophy is of the craft. Right? We believe a properly fed body is going to work well, where the medical community is based on a Newtonian model, right? It's a reductionist type model. So they want to reduce things down to the smallest possible symptom or condition, and then give you a pill to control that, like cholesterol or something like that. Now, when we talk about physical therapy as opposed to chiropractic, right? Physical therapy is based on musculoskeletal, and chiropractic is neuromuscular, right? So physical therapists are usually doing things like if you were in a cast and your muscles have atrophied, or if you have scar tissue that needs to be broken up and things like that. You're dealing with how well the muscles are working, and we're dealing with how well the nervous system is working.
Oh, there you go. So it's neuromuscular.
We're neuromuscular.
Yeah. Neuromuscular, whereas physical PT would be musculoskeletal. Okay, there you go. So that's the big difference. Now I get it. Okay, I have a question, because I remember every time I would go to the chiropractic clinic, or to go for for my session, I have always been encouraged to go through myotherapy. Is that really a requirement? Like, I mean, it feels good. I mean, they do like some hard techniques on your muscles, but is that really a necessity prior an adjustment?
I wouldn't say it was a necessity. Now, depends on the case, right? So if you have a lot of scar tissue or things of that nature, you're going to want to break that up, right? The body can break it up on its own, but it's a very, very slow process. So if you can find somebody that's got some experience and some knowledge on musculoskeletal techniques to help break up some scar tissue, it's going to help. In addition, to help loosen up the muscles, so the adjustment goes easier. So if you spend 5 minutes with some kind of a percussor or some kind of a massager to just help loosen up the muscle, it's going to be beneficial. Now, there's also vibrational therapy, which happens post-adjustment, because we want to try and once you get an adjustment, you want to try and flood the nervous system with information, right? Because what happens is you get two bones, and they're supposed to move, right? Like this. Now, all of a sudden, click, you get what's called a subluxation, and they don't move anymore. So now they're not sending any signal to the brain, and the brain needs information for it to work. A good little comparison would be if you woke up one morning and went for a run. Now you ran a couple kilometers, you're going to be energized the entire day. And if you take another day when you woke up and you sat on the couch and watched a Netflix movie, you almost want to take a nap afterwards. Of course, when you went for a run, you used a lot of energy, so you should be more tired than when you sat on the couch. But you're not, because you didn't feed the brain, right? With a run, you fed the brain with a lot of movement. So that's what chiropractic does on a much smaller scale.
Okay. Wow. Interesting. Well, thank you for that, Doc Scott. Okay. So we have a question here from the UK, actually. And this is June, my very good friend from Swindon. And he says, "Hi, good evening, Tinette, Jury, and Dr. Scott. I'm on break time at work watching from the UK. I would like to pose this question to Dr. Scott. Are there any side effects to getting chiropractic care?" So I believe June is actually in the health industry, so I guess he's also curious, what could be the possible side effects. Of course,
if performed properly, there really shouldn't be any. It's very safe and very, very gentle. You do got to do your due diligence, of course, and make sure that somebody is a good candidate for chiropractic, right? If they're have 95% blockage of your carotid artery, you probably don't want to do some neck manipulation, right? So you want to be a little bit diligent from that aspect. But in just the rarest of cases, if the chiropractor is not being judicious in their care, maybe you could break a rib or something. But again, these are extreme cases that would happen in the rarest of conditions. But as a general rule, no.
No. Okay. So there you go. Our dear friend from the UK, June. So I hope that Doc Scott was able to address your question.
We have a comment here, from Erica Poyawan. She, your friend. He said, "Awesome. I need to say that Doc Scott is one of the best chiropractors in the world who practice holistic living. I admire him for having the genuine desire to inspire people to make positive life choices, whether it is on the food they eat, relationship, career paths they take, their environment, and how they utilize what's around them, and most importantly, how they cultivate personal growth. That's nice.
Thank you
I
for
was just
that.
interviewed by her a week or two ago when we were talking
I'm
about
sorry.
relationships. I said I
Oh,
was just
really?
interviewed by Erica
All
on
right.
her blog about a week ago, talking about
Yeah.
relationships. That's where she's
Oh,
coming
that's nice. Well, you should have told me as well, so we could have included it in the agenda tonight.
from. I was kind of a last minute fill in. I think their guests either
Oh,
canceled or held up
oh,
somewhere, and
wow.
they asked me when I was available, and
Okay.
yeah.
Well, thank you for that comment, Erica. We do appreciate you joining us tonight. Thank you. So, okay, you mentioned jury asked earlier whether it's for all ages, but if you were
Yes.
to admit the youngest patient, how old would that be? I mean,
You can adjust somebody right from birth because, if you've ever seen the birth process, it can be quite violent, right? There's
yeah.
either if they use forceps, they grab the head and they pull it up, or a lot of times, the birth canal looks like this. Your shoulders are here. The doctor will take the head and twist it so we can get the shoulders to turn to the birth canal. And on a little baby, that turning of the head can cause a subluxation. Or think of the fact that a baby is stuck in the fetal position for 9 months, right? And all of a sudden now they're pulling it out, and you just bend the baby backwards. So you can adjust a baby from birth. And I personally have never adjusted a baby at birth because I've never been around a baby that was just born. But plenty of my chiropractic friends adjust their babies and other babies as well in the birth process.
So
Wow. I didn't know
the
that.
oldest doc,
What's that?
the oldest people, for what's
Yeah.
Right?
is it safe for
Chiropractic
the
is for
older
everybody, right? Anybody, if you have a spine, right, you need to be clear of spinal subluxation, right? Because you're going to function better. It's right. It's that simple. Now, I'm not making any claims like chiropractic's curing cancer or anything like that. But if you had cancer, you'd be better off with good nutrition, and you'd be better off with a nervous system that is functioning properly, right? The body's best chance is being clear of any subluxation that's going to cause the nervous system not to function at 100%.
Wow, that's interesting. So there you go, jury. So from birth, I thought all the while that you have to be at least, a teenager to go. I didn't know that you can go, you can bring a baby to a chiropractor. I didn't know that.
In fact, it's a specialty of chiropractic. There's some special training that people that just want to work with infants. It's not my population, but the youngest I've adjusted was probably 4 or 5 years old.
What was the case? I'm just curious. Why was the 4-year-old brought to a chiropractor?
She came in for allergies, right? So she was having a lot of allergies and things like that, and we cleared it up. We just got the nervous system functioning properly, and started working. Right?
Oh, wow.
So
there you go.
Now, I got a little caveat here, right? So technically, I'm not treating her for allergies, right? Just like if you came in for migraines or something like that, I'm not going to be treating your migraines. What I'm going to be doing is assessing your spine, checking for vertebral subluxation, and clearing that out. Now, this may sound a little weird, but take it with a grain of salt. In its purest form, the chiropractor shouldn't be concerned with your symptoms and if they clear up or not, right? Because if you have a subluxation right here on the first bone of your neck, we know that's cutting off life. Now, you may or may not get relief from your headaches, but I know for certain that your body will function better if you don't have nerve interference on that first bone, right? So we hope the body will function normally, and we say that if the body is clear of vertebral subluxation, is getting good nutrition, and the toxicity level is getting removed, and there's not a high mental emotional stress, it should function normally and without any symptoms.
Wow. Okay. Yeah. Okay. Thank you for that. June says thank you, Tinette and Dr. Scott, and we also have another question here from Carmela La Torre. Hi, Carmela. Thanks for watching. And she says, Dr. Scott, do you also go see a chiropractor for your own adjustments or session?
Yeah, my chiropractor is in the Mall of Asia. His name is Doc Mike. He's great. So yeah, he adjusts me twice a week.
Mm-hmm. Okay. What was the worst case that you've ever handled here in the Philippines? I'm just curious.
Here in the Philippines, I see a decent amount of scoliosis patients. Those are usually tough. Also, frozen shoulders are very, very difficult to take care of. I have a woman in my clinic right now. It's got frozen shoulder. There's really no answer of why a frozen shoulder happens. It just kind of comes on and I haven't done any research that can clearly explain why. Right? There's theories, but there's no exact indication of why. So there was a little bit of a struggle. She's gotten some improvement, but she can't raise her arm like that yet. But we're going to keep plugging away, and hopefully we'll get there.
Wow.
Can it also help lose weight?
I did a whole seminar, a whole webinar about weight loss.
Yes.
It's chiropractic is not in and of itself, right? But we would use chiropractic in a weight loss plan, right? As being a personal trainer, right? You know that if you're in pain, you're not going to go work out, right? Plus, if you have pressure on nerve that's going to your thyroid's not going to work properly, right? And then your metabolism drops, you can't lose weight, right? But in and of itself, you can't say, well, I'm going to go to the chiropractor and then afterwards I'll hit McDonald's. And why aren't I losing weight, right? So it has to be part of a complete plan.
Okay. So, Doc, I also have a question. What does it take to become a chiropractor? Do you need to have some certifications for that? Is there a school, or how many years do you need to study? And where is, for example, for Filipinos who wants to be future chiropractors, what's the nearest school they can attend to?
Great question.
And do you need a license for that?
So you need to first get an undergraduate degree in some related field, right? Usually most chiropractic schools require, you can get a degree in pretty much anything in the sciences, but you have to have chemistry, biochemistry, and physics. Those are the three major ones. Then you have to have, I think, 24 credits in biology and a few other things, right? After you get 4-year degree, then you go to chiropractic school. And the closest one to here is there's one in Australia, and I believe there's one in Malaysia as well. So you can attend either one of those two schools. There's a couple in Europe, like I said. United States has 18 of them. And then one in Mexico just recently opened up. Now, every country is different as far as getting a license goes. In this country, we are under, I forgot, it's 4 letters, WASAC or something. I forgot the exact name of it. We're under an umbrella of certain things. So it's kind of a gray area at the moment because it's in the process of being recognized, and then licensure will come under that umbrella. But how long that takes, I'm not really sure.
Okay. All right. Well, okay, go ahead, Jerry.
Sorry. So in your clinics, Doc, there are all of the people there are also chiropractors. Are they Filipinos, or you're the? So
I work with Mabuhay clinics. We have 14 of them around. I'm not the owner of the clinic. A doctor named Dr. Mike Tetrol is the owner. So I work in the Glorieta branch, and then there's another chiropractor. Usually each branch or each clinic has one chiropractor. A couple of them that are busy will have another one that fills in on the days that the primary chiropractor takes off. But usually there'd be one chiropractor at a time at that clinic.
Okay. Right. Okay, so for those of you watching, family and friends who are watching us, please, if you have questions, again, feel free to ask Doc Scott anything, about chiropractic. So, Doc Scott, would you care to share with us some success stories that you've had in your practice?
Probably my favorite success stories, there's a couple of them, is migraines. Migraines very well. They clear up pretty quick. Usually within the first couple adjustments, people feel phenomenal, right? And much better. Even migraine sufferers for years. So I've had several of those. Probably my strangest success is a woman that came in for some aches and pains she had, and after she was been getting adjusted for a month, she started to get normal periods. She confessed to me beforehand she would only get like one period a year, and then in the course of care, and of course I didn't know this. She didn't disclose it to me, and that's not what we were going for. But we cleared the spinal subluxations, and she started getting regular periods. You can actually see her testimonial on my YouTube page. It's on there.
Okay. Fantastic. Wow, that's amazing. All right.
Yeah.
So we have another question from June from the UK, and he says, "It's me again, Tinette. This is for Dr. Scott. How about for cancer patients? Do you think chiropractic care could provide an alternative option to help patients increase strength, flexibility, mobility, and function? It's without a doubt that cancer is one of the most devastating illnesses to befall upon humankind. When we think about cancer, one of the first things that pop into mind is chemotherapy." So that's an excellent question. Thank you for that, June.
I would offer this. I'm gonna get in trouble for this, but say it anyway, right? Chemotherapy kills more patients than cancer ever does. What are you doing when you're doing chemotherapy? You're pumping poison into somebody, and you're hoping you don't kill them. Right? That's why their hair falls out. That's why you get so sick, because you're pumping so much poison into them and hoping you're killing the cancer cells, and you stop just short of death. Now, to me, that is just lunacy. Why would you weaken the body to such a state if you're sick? Chiropractic, we go the opposite way. We say, let's strengthen the body as much as humanly possible. I emphasize again, chiropractic is not a treatment for cancer, and chiropractic does not cure cancer. Right? But if you have cancer, you need a nervous system that is functioning properly. But you also need good nutrition, right? Also, cancer works in an acidic environment. So getting on an alkaline diet is essential. You also need oxygen. Cancer thrives in a oxygen poor environment. So, and chiropractic is excellent for increasing circulation. So, chiropractic, I wouldn't say you got cancer, go to the chiropractor for your cancer. I would say that, if you go to your chiropractor, you're going to increase your tone. You're going to increase your nervous system tone. You're going to increase circulation, but you also need to do these other things.
Wow. That's a lot of information there. So June, I hope Doc Scott was able to give you some insights on your question. And also, Mrs. Glazer is also from the UK. She says, true. She says, true. Chemo kills. It kills the good cells too, and that true alkaline is good. And I concur. So there you have it. So those are our comments from London. So hello, Mrs. Glazer. It's good to have you again with us tonight. All right. So Jury, have you got a couple of other questions for Doc Scott?
I think. I just want to ask this. Do you consider chiropractic an alternative medicine?
So I hate that word, alternative medicine, because it implies that it's kind of like a secondary response, right? Alternative medicine. When in essence, chiropractic has been around. It hasn't been a formal discipline called chiropractic, but bone manipulation has been around long before the allopathic medical community has been around. So I would say they're alternative, if anything. Chiropractic is part of a holistic lifestyle that has been around since since human beings have walked the earth, right? Proper nutrition, good emotional status, getting detoxification to flush out things that we're all exposed to, and getting good physical well-being, which comes with structure, right? So I don't like the word alternative too much.
Yeah.
Holistic.
Well,
I want to say holistic.
So help us here, Doc Scott. What other misconceptions do people have of chiropractic? I mean, are there other things that you'd like for everybody to know that probably, please do enlighten us.
How long you got, right?
No, please, go ahead. We have enough time.
Right. So a lot of say, chiropractic, you're a bone cracker, you're a back doctor, right? It's more of a nervous system doctor than a bone cracker or a back doctor, especially like in the United States, only because they've been exposed to it more. And chiropractic has great success with back pain. So everyone thinks that chiropractic is just for back pain, right? When in fact, chiropractic is for everybody that wants to function at their highest potential, right? And so we're not a therapy. We're not a back pain specialist, and I'm definitely not a massage therapist.
Because there's really how I wish that more Filipinos would try to explore this particular field. I don't think we have a lot of Filipinos, although I have a Filipino chiropractor, a Filipino one and a German one here. So, but I don't think we have a lot of Filipino chiropractors.
Actually, it's good, Tinette, that this has been discussed to give awareness to a lot of Filipinos here.
Right.
It changed the conception about the practice of chiropractic. So at least with this session, a lot of them are aware.
Well, hopefully we'll get a university here, and then we'll see a lot more, because right now it's a little difficult because you have to go overseas to one of these other countries to study it. So I think there are plans in the works to get a university here, and if that happens, then we'll see a lot more popping up.
Right. All right. So Mrs. Glazer says it's an eye opener. Well, that's good, Mrs. Glazer. So now I think a lot of our viewers are starting to realize the importance of being properly informed about chiropractic, because I think there has been a lot of questions, and it's something that's not being discussed a lot. I mean, at least in this country, right, Jury? It's not it's not the first you know what I mean, option, not because they don't like it, but because they don't know about it. So I'm glad that we have this session tonight, and that we're able to at least spread the word around that there are actually other options. It's a holistic option, as Doc Scott said earlier. I guess the question is, how often do you go to a chiropractic clinic?
So it's a little bit of a complex question, because every case is a little different. We have to take into a couple things into consideration. Number one, your age, right? Somebody who's older is probably have been under a spine that's been degenerated a lot longer, so it's going to take longer to correct. Number two, lifestyle, right? Somebody who's doing construction work versus somebody who's a desk worker is going to be under different types of physical stress that we have to take into account. And then number three, how much damage, degeneration, or spinal subluxation the person has, right? And that we would determine with an X-ray. And so we take all this together and we combine it, and from there we come up with a care plan. So there are three stages in the care plan, right? There is the intensive phase, which our primary goal is to stop the damage and degeneration that's going on. Once we get the body stable, then we go into a corrective phase, which we're trying to bring back the natural curves in the spine. Your spine has three curves, one in the thoracic, and then two in the neck and the lumbar, which go a certain way. So then we want to strengthen some muscles so we can hold those positions. And then finally, we go to maintenance care after that, which would be, again, depending on age and lifestyle, once every week, once every 2 weeks, something like that.
Wow. Okay.
Was there a situation, Doc, like an athlete who went to your clinic for a session, and then you just found out that he needs more than just chiropractic sessions? I think he that you advise him to go to an orthopedic hospital? Was there an instance that you?
I have not had that, because usually if an athlete gets injured, it's probably through on the field injury, right? And there's usually an athletic trainer that's on the field most of the time. The athletic trainer, they're excellent at their job. They can determine right away whether you have, like an ACL tear or a labrum tear, which would be a surgical case, not a chiropractic case. So chiropractic usually works as a team, right? Which consists of a physical therapist, a massage therapist, an orthopedist, right? And a chiropractic would fit within that team.
Yeah.
Okay.
Nice. Okay, great. Thank you so much. Okay, well, Doc Scott, would you like to well, I'm going to show the your website here. So, ladies and gentlemen, if you'd like to get in touch with Doc Scott, Dr. Jahn, feel free to visit his website, which is flashed on screen at the moment. And he's also on YouTube, Instagram, Facebook, and Twitter. So feel free to look him up. I mean, his name is quite unique, Scott Jahn. So I think you're the only Scott Jahn that I know. So it would be very easy for us to get in touch with him. So would you like to share like a last message for everybody, Doc Scott? Feel free.
Yeah, sure.
Or promote
I would say
anything.
Just the fact that, if you're the type of person that doesn't like taking drugs, if you're the type of person that wants to express more of your potential, chiropractic is for you, and you should look into it and give it a shot.
Nice. Okay, so there you have it, guys. Thank you so much. So for to all our viewers tonight, please don't forget to follow us on Facebook, where this video is being streamed. So Tinette Cortes. Again, my name is Tinette Cortes. I'd like to thank everybody who joined us tonight. My friends from the Philippines, the UK, the US, Singapore, Nigeria, and everywhere else. Thank you to everyone who also asked those brilliant questions. And I hope that we were able to add value to what you already know, and provide you with more information. And of course, I'd like to thank my very dear friend Jury for joining me tonight. My very fit and athletic brand. So Jury, do you want to share anything? Do you want to promote anything? Your businesses?
Not so far. I just want to say hi to my brother and also to my friend Ned, and my relatives in Australia, Ate Cookie. So hi there.
Are they all watching?
Yes.
Yay. Thank you for watching, guys. So with that, Doc Scott, thank you very much for your time. I know that it has been an absolute pleasure to have you with us, and we learned a lot, and I hope that our viewers will be able to consider this very how would I describe it? It's life-changing, I think. Right? It's a life-changing choice. So with that, thank you very much again, ladies and gentlemen. Again, my name is Tinette Cortes, and please do not forget to follow us on Facebook and visit our website, www.consultasiaglobal.com. So thank you very much again, Doc Scott, and good night for now, everyone. Bye.
Bye, guys.
Bye.